Hello, I'm Bishop Robert Casey, Vicar General of the Archdiocese of Chicago. The COVID-19 pandemic has been a challenging time for all of us, but there is light on the horizon. Vaccines are currently in distribution, and getting vaccinated is among the most important things to do for your health and the health of others. As Catholics, it's important to remember that the U.S. Conference of Catholic Bishops, as well as the Holy See, has concluded that getting the COVID-19 vaccine is an act of love of neighbor and part of our moral responsibility for the common good. It's one of the most important ways to protect your life and the lives of all God's children. Joining me now for a medical perspective on the vaccines is Dr. Rachel Rubin from the Cook County Department of Public Health. Dr. Rubin, thank you for joining us.
Thank you for having me this morning.
What's the most important thing people should know about the COVID-19 vaccines?
I think the most important thing to know about the vaccines is that they are safe and effective, and it is our best chance of handling and conquering the pandemic at this point.
Why is that, Doctor?
Vaccinations are the way we get the population immune to the virus, so that if they come in contact with the virus, they will not get sick from it, or even if they do contract the virus with the vaccine, you tend to get a very, very mild case of the illness. And the way we get back to some sense of normalcy, where we can start enjoying our lives again in a more open and close manner, is that we need this vaccine. If we are immune to the adverse effects of the infection, then we can go back to having more of a normal kind of daily life.
Doctor, what would you say to people who are hesitant to getting a vaccine?
I understand, I acknowledge, I know that there are reasons to feel hesitant about the vaccine. One is that people think that it was developed too quickly, but the technology itself behind the vaccine, especially even these newer vaccines that are out now, have been in the works for over 10 years. That the development of this kind of technology is not new. But it doesn't mean that things were hurried and that there were shortcuts taken that would make the vaccine less safe.
Dr. Rubin, thank you for joining us and giving us some perspective.
Thank you very much for having me.
I want to thank all of you for joining us. For more information, you can go to our website at archchicago.org/coronavirus.